Hello guys, welcome back to Clinically Clear. So today we'll be covering a very important topic, that is bacterial conjunctivitis. Now, bacterial conjunctivitis is the most common type of conjunctivitis. And in the most common type, which is the most common causative organism, the usual Staph aureus. You have other causes like Streptococcus, Haemophilus, Pneumococcus, etc. Now let's look at some things that are common to all types of bacterial conjunctivitis. First of all, the risk factors. These are all, actually it is common for all types of conjunctivitis only. That is poor hygiene, poor sanitation, overcrowding, increased population of flies, sharing of towels, sharing of handkerchief, fomites, etc. So these are some risk factors. Then the routes of infection. See, there are three main routes of infection. The most common route is exogenous route, where in exogenous, you have multiple types. Either it can be directly into the conjunctiva, like some infected water or infected air, or it can be through vectors like flies, or it can be through infected material transfer. For example, some sharing of some infected towels or infected fingers. I touch my eyes. So this is exogenous. Endogenous route of transmission via blood, very, very rare. And one more route of transmission is local. Example, let's say there's a lacrimal sac infection or there's a nose infection that can spread directly to the conjunctiva. So these are routes of infection, routes, risk factors, and causative organism. So this is common to almost all. Now, the most common type under bacterial conjunctivitis is acute bacterial conjunctivitis or acute mucopurulent conjunctivitis. Here also the most common causative organism is Staphylococcus aureus. And here also you have other causes like Streptococcus, Pneumococcus, Haemophilus. That's why I've written others also. Acute mucopurulent means acute bacterial conjunctivitis. Very, very important. Now, why is it known as acute mucopurulent? Let's come to it. First, let's look at the symptoms. Mucopurulent discharge. And see, some of these are common to all types of conjunctivitis, like itching sensation, burning sensation, foreign body sensation, and it is acute conjunctivitis, right? And as I told in the previous video, conjunctivitis is always accompanied with conjunctival congestion that causes redness of the eye. So sudden onset redness. And one more thing is, because of the mucopurulent discharge, it comes and sits over the eyeball. And this mucopurulent discharge over the eyeball, it acts like a layer of fluid. So it splits the light, it disperses the light into vibgyor. So that causes colored halos. So the colored halos, the blurring of vision, all that is because of the discharge, the mucopurulent discharge that accumulates over the eye, that splits the light and it scatters the light, etc. And sticking sensation of the eyelids, stickiness of the eyelids, of course, because you have discharge underneath the eyelids, which is causing it to stick to the eyeball. So these are the symptoms. Now, symptoms are what the patient comes with. Signs are what the clinician looks for. So mucopurulent discharge itself can be a sign. Sudden onset redness, what is it? It is nothing but conjunctival congestion. Because of conjunctival congestion, you have sudden onset redness. It is also known as fiery red eye. Then you have something known as ecchymosis or subconjunctival hemorrhage. Now, ecchymosis or subconjunctival hemorrhage, it does not require any treatment. It is self-resolving. You just let it be there. Subconjunctival hemorrhage itself can also contribute to this redness. Chemosis is swelling of the bulbar conjunctiva. Because of the inflammation of conjunctiva, the bulbar conjunctiva starts swelling up. That is chemosis. And the last sign is papillae. Now, what is papillae? As I told in the previous video, bacterial conjunctivitis, you will have mucopurulent discharge and papillae. Papillae is basically dilated hypertrophic blood vessels that gives it a red velvety appearance. That is papillae. So symptoms done, sign done. Mucopurulent discharge. Very, very important. Then coming to what are the differential diagnosis. It can be any other type of conjunctivitis, one differential diagnosis. Another thing, you've seen the patient has red eye, red colored eye, full redness in the eye because of conjunctival congestion. But it can also be other causes of acute onset of red eye, like any trauma that can cause redness, any keratitis, not just conjunctivitis, even keratitis can cause redness, any subconjunctival hemorrhage, as I told, ecchymosis because of any trauma or anything like that. So this is the differential diagnosis. Now, the treatment of acute mucopurulent conjunctivitis, simple. Before you get to know which organism itself, you have to start them on broad spectrum antibiotics. So topical antibiotic eye drops. So always the topical antibiotic eye drops that you prefer is 0.3% fluoroquinolones like levofloxacin, ofloxacin, ciprofloxacin. Okay. And you take that mucopurulent discharge and you give it for culture sensitivity. Then you will get the specific antibiotic. After that, you can switch to the specific antibiotic. But till then, you have to go with topical antibiotic eye drops like broad spectrum antibiotic eye drops like 0.3% levofloxacin, ofloxacin, etc. Then what did I tell? The main problem is the discharge that is causing the stickiness, the blurring, the foreign body sensation, the colored halos. So you just have to irrigate it. So when you do saline irrigation 3 to 4 times a day, what happens is this discharge gets washed off. So because it gets washed off, the vision improved. The vision improves and the colored halos, they disappear. So that is one thing you need to remember. And also, to treat the symptoms like itching, burning, and like to reduce inflammation, you can give anti-inflammatory analgesics for symptomatic relief. And to reduce the photophobia, let's say conjunctivitis associated with photophobia, then you can also give goggles, dark goggles. It will reduce the amount of light entering. One thing very important, you should not give steroids because steroids will suppress the local immunity, so infection will get worse. Steroids will also cause thinning of the corneal epithelium, so don't give steroids. And also don't put bandages. Patient will assume, oh, there's some injury there, let me put a bandage. But the thing is, when you put a bandage, the temperature increases, and when the temperature increases, it will also cause the bacteria to proliferate more. So the contraindication is steroid and bandages. So what are the treatment? Topical antibiotic eye drops, 0.3 levofloxacin, dark goggles for photophobia, then anti-inflammatory analgesics for symptomatic relief, and saline irrigation to improve the vision and to reduce symptoms. Do not give steroids, do not put bandage. So that is about this thing. What treatment of acute bacterial conjunctivitis. Next type, the most dangerous type under bacterial conjunctivitis is hyperacute bacterial conjunctivitis. Now, what is hyperacute bacterial conjunctivitis? Why is it known as hyperacute? Because the onset of symptoms is within 12 hours. Within 12 hours, you have onset of conjunctivitis. That is hyperacute bacterial conjunctivitis. Then you have this thing. If this hyperacute bacterial conjunctivitis occurs in neonates, then it is known as ophthalmia neonatorum. But let's say it occurs in adults. Then only one organism causes it, that is Neisseria gonorrhoeae. So this Neisseria gonorrhoeae, it has oculogenital transmission. That is, it transmits from the eyeball to the genitals. So that is oculogenital transmission, Neisseria gonorrhoeae. That is why it is also known as gonococcal adult conjunctivitis. That is hyperacute bacterial conjunctivitis caused by Neisseria gonorrhoeae is known as gonococcal adult conjunctivitis. It spreads from the genitals to the eyes. So oculogenital transmission. This is only in adults. Okay, remember that. Now, this hyperacute bacterial conjunctivitis, it is also known as acute purulent conjunctivitis, not acute mucopurulent. Acute mucopurulent is acute bacterial conjunctivitis. Acute purulent is hyperacute bacterial conjunctivitis. And it is also known as blenorrhea. Why is it known as acute purulent or blenorrhea? Mainly because of the copious amount of purulent discharge. There's a lot of purulent discharge. If you look at this picture here, you can see there's a lot of pus, excessive amount of pus. So this copious amount of purulent discharge basically can cause, that's why it is known as blenorrhea or acute purulent conjunctivitis. So symptom purulent discharge, sign copious purulent discharge. Symptom here is redness. Again, redness, of course, I told you conjunctival congestion. So here also sign is conjunctival congestion. Pain, very important. Whenever you have a bacterial conjunctivitis with a lot of pain and it comes in sudden onset within 12 hours, you have to immediately suspect this. So pain, what is the sign for pain? Tenderness. Swelling and pain in the eyelids. What is the sign? Tender inflamed eyelids. Symptom is swelling and pain. Sign is tender and inflammation of eyelids. Symptom is just pain in the eye. Sign is tenderness of the eye. Then again, because of the excessive amount of purulent discharge, patient will have sticking sensation, foreign body sensation, burning sensation, itching sensation, colored halos, blurring of vision. So these are all common in all things where we will have a lot of discharge. Common symptoms for conjunctivitis. Then what is the sign here? Signs, two very important signs here are pseudomembranous conjunctivitis. See, when you have so much pus building up there, what happens is that pus starts to form a membrane. So that membrane, it can be easily peeled off. And whenever a membrane can be easily peeled off, it is actually not a true membrane, but it is a pseudomembrane. And pseudomembranous conjunctivitis, one best example is this adult gonococcal conjunctivitis or hyperacute bacterial conjunctivitis. Now let's say if when you're pulling a membrane in conjunctivitis, let's say it starts bleeding, then it is true membranous. And this true membranous conjunctivitis, it bleeds when pulled, and the most common cause In non-immunized children is Corneobacterium diphtheriae. In adults it is pneumococcus. There is one more thing. So basically the sign here is what? Pseudomembranous conjunctivitis. Not much remember enough. And also one more thing here is tender preauricular lymphadenopathy. Very, very important. Preauricular tender lymphadenopathy. Hyperacute bacterial conjunctivitis will be accompanied with tender preauricular lymphadenopathy. So that is the signs and symptoms. And very, very important one thing, complication. You have to treat it immediately. You have to start treating it immediately, because otherwise what will happen? There will be corneal ulceration, there will be opacification, and there will be permanent blindness. You have to immediately recognize that this is hyperacute bacterial conjunctivitis, lot of pain, lot of pus, preauricular lymphadenopathy, pus even forms a pseudomembrane there, you can pull it off. So you have to start treating immediately, because otherwise the infection can enter the cornea, it can cause an ulcer. When the ulcer heals with fibrosis, it leads to an opacity, blindness. And also the infection can spread deep within into the iris and all, leading to iridocyclitis. But the part that we're dreading the most is this blindness, because you're not treating it promptly. Treatment is, see, this is a more severe infection, gonococcal, Neisseria gonorrhea, acute onset, lot of pain, lot of pus. So topical antibiotics, it won't be able to reach everywhere. So we prefer systemic antibiotics, and initially we even give intramuscular. First we give 1 gram third generation cephalosporin like ceftriaxone. So 1 gram ceftriaxone intramuscular single dose. 1 gram intramuscular ceftriaxone single dose. Followed after that, followed by 1 week of erythromycin QID. 4 times a day, oral erythromycin for 1 week. So always remember, everything else is the same as acute mucopurulent conjunctivitis, the previous one, that is acute bacterial conjunctivitis. Give dark goggles for photophobia, do saline irrigation to wash the discharge off, give anti-inflammatory and analgesics. But here we won't give topical antibiotics, we'll give systemic antibiotics, and the systemic antibiotics also we'll give is 1 gram ceftriaxone intramuscular single dose injection, followed by that we have 1 week erythromycin QID. So that is 1 week of oral erythromycin QID. This thing is supportive treatment is same as acute mucopurulent conjunctivitis. One very, very important thing you need to remember in hyperacute bacterial conjunctivitis is both the partners need to be treated. Let's say the male partner has, you have to also treat the female sexual partner, because otherwise, as I told, it has oculogenital transmission. There's a risk of the female also getting it. There's a risk of someone else if the male or the female is having multiple sexual partners, it will spread more, right? So you have to remember, because it has any disease with oculogenital transmission, you have to treat both the partners. So this is about hyperacute bacterial conjunctivitis. Next, coming to chronic bacterial conjunctivitis, also known as simple chronic conjunctivitis or chronic catarrhal conjunctivitis. Here also, most common causative agent, Staphylococcus aureus. Now, here one thing very important you need to remember is the risk factors. 3 things, just remember 3 things. Chronic exposure to irritants, chronic local irritation, or chronic eye strain. See, excessive chronic eye strain, let's say the patient has uncorrected refractory error. Okay. So he's continuously squinting the eye, straining the eye. It's chronic eye strain. Chronic local irritation because of any foreign body in the eye, because of trichiasis, which is basically any eyelash touching the eye. So that is chronic local irritation. Chronic exposure to irritants like sunlight, smoke, dust. So these 3 are the main risk factors. And how does it happen? What is the mode of infection? Again, as I told, exogenous, that is either it will come from fingers, flies, fomites, or direct through waterborne or airborne. Or acute mucopurulent conjunctivitis, acute bacterial conjunctivitis becomes chronic catarrhal or chronic bacterial conjunctivitis as a sequelae or a consequence of acute mucopurulent conjunctivitis. Or a chronic infection from the nose, chronic rhinosinusitis, chronic rhinitis, or chronic infection in the lacrimal sac, chronic dacryocystitis. They spread to the conjunctiva, leading to chronic bacterial conjunctivitis. This is the mode of infection. Symptoms, again, basic generic common symptoms like difficulty in keeping the eyes open, redness of the eye, burning sensation, itching sensation, foreign body sensation, stickiness, blurring of vision, mucopurulent discharge, whatever you saw in the previous ones, again, but more of chronicity. And signs, as I told, what are the 2 things that and mucopurulent discharge? What are the three things that I told in the introductory video? Bacterial conjunctivitis meaning mucopurulent discharge, and conjunctival congestion that causes redness, and papillae. Papillae is what? That red velvety appearance because of dilated hypertrophic blood vessels in the conjunctiva. So that is about signs. Next, let's come to the treatment of chronic bacterial conjunctivitis. See, treatment is prolonged course. Same thing, broad spectrum topical antibiotics, 0.3% levofloxacin, etc. But why prolonged course? Because it is a chronic infection, right? It will take time, it will be stubborn, it will take time for it to go. Along with that, as I told, because the patient would have had symptoms from a long time, he'll have a lot of irritation. So to give that symptomatic relief, you can give some astringent eye drops like lubricants, etc. Okay, that is one thing. And main thing is remove the risk factor. What is the risk factor? Chronic local irritation, chronic exposure to irritants, and chronic eye strain. So remove the risk factor, correct the refractory error, remove the foreign body, surgically correct the trichiasis, reduce exposure to irritants, etc. Now, let's come to a special type of chronic bacterial conjunctivitis known as angular bacterial conjunctivitis. Now, why is it known as angular bacterial conjunctivitis? Because all these inflammatory changes, they are confined to the angle of the eye. This is the angle of the eye, right? So they are confined to the angle of the eye. Why? Now, angular bacterial conjunctivitis is also known as diplobacillary conjunctivitis. Why? Because diplobacilli are nothing but this organism known as Moraxella axenfeld. This Moraxella axenfeld, it comes from the nasal cavity. And then what it does is, it starts secreting a few enzymes, proteolytic enzymes, like which can break down and cause tissue damage. Now, proteolytic enzymes, why don't they cause damage everywhere? The thing what happens is, the tear film always gets washed towards the angle of the eye. So this tear film, it washes these proteolytic enzymes, and the enzyme starts getting collected near the angle of the eye, close to the angle of the eye. So then what happens? Because it's confined to the angle of the eye, the inflammatory changes because of this proteolytic digestion, the tissue damage, they are also confined to near the angle of the eye. So that is one thing you need to remember. And the risk factors are same as chronic bacterial conjunctivitis: chronic irritation, chronic exposure to irritants, chronic local irritation, chronic eye strain. Because as I told, it's a type of chronic bacterial conjunctivitis, right? So that is about the angular bacterial conjunctivitis. Then what is symptom and signs? So symptom and signs is, here I'm combining both symptom and signs. Again, the same common symptoms like stickiness, itching, burning sensation, foreign body sensation, congestion, chemosis, ecchymosis, etc. But few very important things here to remember is excoriation of the skin and lid swelling. Basically, what happens? Surrounding the angle of the eye, the skin surrounding the angle of the eye, also you have excoriative changes. That is basically the proteolytic enzymes there, not just the conjunctiva, but the skin surrounding near the angle of the eye, excoriation of the skin surrounding the angle of the eye, the lid swelling. Because it also affects the lids, the most common complication also is blepharitis. Now here the treatment is a bit different. That is 1% tetracycline eye ointment. We don't give topical eye drops, because here the changes are near the angle of the eye. So if I give eye drops, it will spread everywhere, right? But we want it only near the angle of the eye. So that is why we give ointment, so that we can apply it there. So 1% tetracycline eye ointment. And very, very important, we give zinc lotion. Angular bacterial conjunctivitis, we always give zinc because zinc inhibits this proteolytic action. The main problem, the reason why it is angular bacterial conjunctivitis, is because this Moraxella axenfeld, it secretes these proteolytic enzymes, and these proteolytic enzymes are the ones that get washed, and it causes these inflammatory changes around the angle of the eye. So that is why we give this zinc lotion, so that these proteolytic enzymes, they get inhibited. So a little long video, I realize it, but the 4 topics of bacterial conjunctivitis I've covered. I've tried to keep it concise. I've tried to include everything that I felt was important. So if you guys enjoyed the video, please do like, share, subscribe. Thank you for watching.